Good afternoon, everyone. I'm Dr. Bissell, the Director of the New River Health District, and I'm here to give you the latest update on the COVID-19 pandemic in our region. Today is Monday, December 14th. Across the state, we're seeing substantial levels of community spread. This is a critical period in the pandemic, and we need to think about the risks to our frontline hospital workers handling the increased caseload. COVID hospitalizations are at an all-time high across the state and across the country, and this is on top of the hospitalizations for other medical conditions. We need to think of our vulnerable populations in nursing homes and correctional facilities, as well as any high-risk family, friends, and neighbors, and we need to do what we can to protect ourselves. You know the drill. Watch your distance, wash your hands, and wear a mask. These things really do help decrease the spread of COVID-19. Although we are starting a vaccine program, it will take months before it makes a dent in the pandemic, and we have a lot of hard work ahead of us. These are the things we can do right now to decrease the spread of COVID-19 and to keep ourselves and our communities safe. Initial supplies of the vaccine will be limited. We will be following the CDC's Advisory Committee for Immunization Practices recommendations for prioritization. Frontline hospital staff and nursing home residents and staff, emergency medical services personnel, dialysis units, congregate settings such as residential substance use and mental health facilities or correctional facilities, and then other healthcare workers, home health and hospice, physical, occupational, and speech therapy, ambulatory surgery centers, free clinics and federally qualified health centers, community service boards, mental health, primary and specialty care, optometry, dental practices, and pharmacies. This will be followed by high-risk individuals older than 65 and those with other comorbid conditions, as well as the general public. We hope to be doing community vaccination by late spring. Because of this high level of community spread, VDH has broadly announced new guidelines for contact tracing. Prioritization will be case investigations and contact tracing for people diagnosed with COVID-19 in the past 6 days, schools, people associated with congregate living facilities like nursing homes or correctional facilities, people involved in a known outbreak, and people who are at higher risk of having severe illness if they get COVID-19. These are cases where contact tracing is most likely to have an impact on the spread of disease. In the New River Health District, we were already prioritizing these groups in our contact tracing. It's good public health to focus our resources where we can have the biggest impact. Because of the high volume, it's impossible to contact every individual with COVID-19 in their contacts. So you can help us if you get a positive test or you start showing symptoms by self-isolating for 10 days and reaching out on your own to contacts to let them know that they should be taking precautions like self-quarantining and getting tested 5 to 7 days after exposure. By doing this, you can really help slow the spread of the virus. Another way you can help is to have what we're calling a small-a-day. You can have a nice, cozy, intimate holiday with the family in your household, and you can find ways to spread your cheers safely. Write a nice card, pick up the phone, schedule a Zoom call, or send a gift to share the holiday warmth virus-free. I'd like to remind everyone again that data is a tool for public health and we take it very seriously. Now that we're in the midst of a pandemic, the public is more interested than ever in this data and we are making it available on many dashboards. Our epidemiologists are data experts. They are not influenced by political or personal agendas inside or outside of VDH. The numbers reported are just that, numbers. It's the context that is more nuanced but so important to understanding our local experience. Anytime you're looking at COVID-19 data, you should consider the context for more accurate interpretation of what the data means. Thank you to those who have written with questions. My answers will be on the nrvroadtowellness.com website as always. Stay warm and stay safe. Thank you.